It's hard to believe that over 75 years ago, a committee known as the Broward Hospital Association convinced the city that there was a need for a stable, reliable hospital in Broward County. Strongly supported by the Broward County Medical Society, the committee collected public funds, private contributions, and donated equipment to renovate the Granada apartment building on Southeast First Avenue. On January 2nd, 1938, this apartment building, which was then called Broward General Hospital, was ready for its first patient. It had 45 inpatient beds, 1 operating room, 1 delivery room, and 1 x-ray machine. What it didn't have was air conditioning or heating. In fact, one of the early doctors who practiced there remembered that the patients sometimes hid under blankets to keep warm during the cold snaps of winter. And it was 13 days after the hospital's opening that the hospital had its first baby girl. Now, fast forward 75 years, and our petite 45-bed hospital today has 716 inpatient beds, 3,200 employees, and every piece of state-of-the-art medical equipment you could imagine. It's been a long journey for us. We've had our share of tough challenges, whether it was getting enough funding, keeping construction on track, or incorporating new technologies into the hospital that weren't even invented when we first opened our doors. So today, as we reflect on our 75th anniversary, let's pause a moment. Let's think of all the children who were and will be born here. Let's think of all the people who came here for treatment and those that will come here for comfort, healing, and hope. Think of the disease that will be fought here. Think of the young doctors and nurses who will learn their life's calling here. Think of the medical research breakthroughs that will be uncovered here. And think of the countless miracles that happen inside these walls every day.
First of all, it's an honor to be the Chief of Staff at this institute. My predecessors have done a phenomenal job, and they became my guiding light. We made a lot of innovations. We are considered as the flagship of the hospitals. Physically, I saw the new building, the atrium building being erected. I saw the towers being reconstructed. We started our Da Vinci robotic surgery in the OB/GYN general surgery and oncology surgery. And that puts us at the top percentile hospitals in the country.
It's been a great 20 years. We've seen a lot of things change. One of the biggest events that I've lived through was building the new emergency department, which we opened in 2005. Other things that we've done that are remarkable is creating a much better bridge between the pre-hospital providers, paramedics, and EMTs, and the hospital itself, where we have now Broward Sheriff's Office, City of Fort Lauderdale, and Tamarack, almost 1,300 paramedics tied into the Broward Health family. I think these have been great changes, momentous changes. It's been a great ride for me. I'm looking forward to another 20 years of excellent teamwork, providing great patient care to the community, and just continuing to lift up the level of care that we provide.
I've been here since 1979. I came here out of cardiology fellowship training with a legendary cardiologist at Georgetown University, Dr. Proctor Harvey. I came here to join the cardiology practice of Dr. Henry Cooper, a very close friend of Dr. Harvey's at the time. Dr. Cooper was the pioneer cardiologist here at Broward General, starting and guiding the cardiovascular service line from its inception, opening up the very first 4-bed cardiac care unit in the 1960s. We were one of only 50 worldwide at the time. Over the years, as the cardiovascular service line expanded and Broward County grew, we recruited and assembled an outstanding group and team of cardiologists and cardiovascular surgeons, along with very compassionate and caring nurses and technical staff. And with the growth of Broward County and the help and support of wonderful members of Broward County and our community, we brought a new vision for cardiovascular services to Broward General.
I have a lot of memories, being the first baby born at Broward General on January the 15th, 1938. And what's amazing, my mother did not realize this until you all celebrated your 30th anniversary. Growing up in Pompano, I've seen a lot of changes, but I jokingly told them whenever they turned 50, well, if I'm around when you're 75, you may have to come after me in a wheelchair, but thank the Lord they didn't have to do that. And thank you so much for letting me be a part of this.
I've been here at Broward Health Medical Center since 1984. Of course, when I started, it was Broward General Medical Center. I was kind of destined to work here. I mean, my father and my mother both worked here. My dad started here in 1959 and worked here 40 years before he retired. My mom started working once all the kids were a little bit older, so she worked here over 20 years. I was born in the West Wing, and then the towers came along shortly thereafter. And so I've seen just how it's progressed over the years. When I got the job here, didn't realize I'd spend a lifetime here, but now I realize this will be probably the only place I'll ever work, and I don't think I would ever want to work anywhere else. This is a great place.
I started my career in oncology, where I worked as a registered nurse and became an oncology certified nurse there. We started outpatient oncology in a room on 4 North Tower, and then that expanded to our cancer center today, where we have our patient infusion center. I have also been here to see mammography change from a room in radiology to a breast center that we opened back in 1985, and that has evolved to an amazing women's health center now, which we call the Lillian S. Wells Women's Health Center.
I've enjoyed working here for 42 years. The reason I started working here was I had a passion for people. My grandmother was like a community person who took care of the community. So when I decided that I was going to go into nursing, after being here during one of my summer months working as a nutrition services aide, I thought that may have been my passion, and that is the reason why I've been here for these last 42 years, and I've enjoyed every minute of it.
Well, it's been great being here for 37 years. I never thought I would be in one place for that long, but it's gone fast. The hospital, the facility is it's like a family. You work day to day, and you're here a big percentage of your time, and it's just been great. I met my husband here, and he's been here 40 years in respiratory care, and he was born actually here and grew up in Fort Lauderdale. Our children were born here, and it's just been phenomenal. Not only do you have a family at home in your personal life, but it seems like a family here as well.
I've had the privilege of being at Broward Health Medical Center for this year will be 41 years. We have a little family joke. I was actually born here. I started here at 17, so the joke is I was born here, they let me go home for 17 years, and I've been back ever since. I've actually had the blessing of being able to see an involvement of the system. I've seen this when we opened the new atrium. I've seen us create the Cardiac Center of Excellence. I actually worked on the very first open heart patient we ever did here. So many things that has progressed, and it's just been so fulfilling to be able to see these different things and to see how it was really kind of a little small community hospital, and now we're a world-class medical center.
When I first started working here, I started in the cafeteria. I started as a nutrition service aide, and I worked my way up to a cashier, and from a cashier to a supervisor. There was so much time I had worked when I first started here at Broward Health. I had to take a whole month off from work because I enjoyed coming to work every day. Never missed a day for work. We have teamwork now, but back in the past, teamwork wasn't like it is right now. We're a great family now.
In 1965, when I started nursing school, I thought nursing was just taking care of people at the bedside. My whole career over those many years has evolved to where I am now, and I find I can use so much of what I've learned over those years, both academic knowledge and real life, just experiences with people. I even find the palliative care experience helps me with trauma patients.
When I came into pediatrics, We didn't have a PICU, pediatric intensive care. And while I was in pediatrics, that was created on the 7th floor here. I'm proud to say that I'm a part of a great institution. Chris Everett Children's Hospital has created the Peds HEMOC Center on 8 South Tower, and we have 24-hour care. We have pediatric outpatient oncology. We do everything pediatrics, and I'm proud of that.
It's a real honor to be the Chief Executive Officer of this medical center and to celebrate our 75th anniversary during this time. And it's quite humbling to think about what these walls hold for tomorrow. As you and I both know, the story of our medical center has just begun.
Whereas over the years, Broward Health Medical Center has served as a pioneer in the Broward County medical community. It was the site of Broward County's first kidney transplant in 1969, the first facility in Broward County to open a cardiac catheterization lab, and in 1974, the first hospital in the Southeast to have an EMI brain scanner. And whereas Broward Health Medical Center, located in the city of Fort Lauderdale, continues to deliver on its promise to offer the highest quality medical care to Broward County and the surrounding areas through its commitment to physician excellence, technologic advancement, and academic affiliation. Now therefore, we as the City Commissioners of the City of Fort Lauderdale, Florida, do hereby proclaim January 30th, 2013 as Broward Health Medical Center 75th Anniversary Day in the City of Fort Lauderdale, and do thank Broward Health for providing and promoting decades of health and wellness services to the Broward County community, and do fully support the facility's continued success and prosperity.